Bismillahirrahmanirrahim. Quote of the day: if we are growing, we are always going to be out of our comfort zone. Today, the topic of my presentation is growth chart under supervision of my professor, Dr. Sahar Afzal. Learning outline that includes introduction, types, CDC growth charts, WHO growth charts, their application, and recent updates. And then learning outcomes. By the end of this presentation, participants would be able to describe importance and application of growth chart. Child malnutrition. It is a major public health issue worldwide and it requires child health surveillance. And by tracking children's height and body weight, the standards detect children not growing properly and require specific medical public health responses. As we all know that there are three main phases of malnutrition according to WHO 2021 report. The prevalence of stunting of children under 5 is found to be 149 million, and 45 million children under 5 are affected by wasting, and 39 million children under 5 are affected by overweight. As we all can see from 2000 to 2020, that the prevalence of stunting has fallen from 33% to 22%. However, there is a quite increase in overweight and wasting, but there is some decline in stunting, prevalence of stunting. Now, what is growth chart? It is a visual display of child's physical growth and development. It is a graphical representation of anthropometric parameters, and the other name coined by WHO is Road to Health chart. The uses are growth monitoring, diagnostic tool, planning and policy making, educational tool, action tool, and evaluation. Its purpose is to monitor child's growth. Second is to monitor trend of growth. The indicators used to monitor malnutrition are weight for age, height for age, and weight for height. And in acute malnutrition, there is decreased weight for age and weight for height. However, height for age is normal. But in chronic malnutrition, weight for age, height for age are lower than normal, while weight for height, that is normal. So the scales of measurement which are used when we are plotting the growth chart, the two main scales, they are z-score and percentiles. We all know that z-scores are used to describe mathematically how far a measurement is from the median, and percentiles are measurements that show where a child is compared with other kids. For example, if a child's weight is at the 50th percentile line, that means that out of 100 normal children of her age, 50 will be bigger than she is and 50 smaller. Similarly, if she is in the 75th percentile, it means that she is bigger than 75 children and smaller than only 25, compared with 100 children of her age. So they are the three basic types of growth charts: NCHS, which is acronym for National Center for Health Statistics, then WHO growth chart and CDC growth chart. NCHS growth charts 1977. It was launched in 1977 and it was adopted by WHO for international use. The data used to construct a reference covering birth to 3 years of age came from a longitudinal study of children of European ancestry from a single community in the USA. Limitations of this chart: that the sample consisted primarily of the white middle class infants from Ohio. So birth weights were collected from 1929 to 1975 and did not match recent national birth weight distributions. And all infants included in that study were formula fed. Differences between recombinant length measurements from the FALS data and the stature measurements from the NCHS data were larger than expected when the transition was made from recombinant length to stature between 24 and 36 months. Now, coming to CDC Growth Chart 2000. The new features of CDC growth charts, there are BMI for age charts for children and adolescents aged 2 to 20 years, 85th percentile to identify at risk of overweight added to the BMI for age chart and weight for stature chart, 3rd and 97th percentiles added to specific charts. The limits for length and height were lower. Smooth percentile curves and z-scores agree. So these are the charts for both boys and girls. This is for boys, weight for age and length for age chart. This is for girls, weight for age and length for age chart. Here we can see that this is the age is given from birth to, it is for up to the 2 years. And here length and weight is given. And when we are trying to find the parameter and the parametric parameter of children, we first plot the age with the relevant weight and height of that children. Then then we draw the line, vertical line and horizontal line, and where the two lines meet, then we point that line of intersection, and then we trace the immediate curve, and then we trace it up to the end of that curve, and the percentile or z-score where it is given, it is that it shows that the child is falling in that range. Now, WHO growth charts. WHO Multi-Center Growth Reference Study. It was undertaken between 1997 and 2003 to generate new growth curves for assessing the growth and development of infants and young children around the world. The MGRS collected primary growth data and relevant information from approximately 8,500 children of 6 countries: Brazil, Ghana, India, Norway, Oman, and USA. It provides a single international standard that represents the best description of physiological growth for all children from birth to 5 years of age. So this is the WHO Multi-Center Growth Reference Study. These are the places where this study was taken place. So it is a longitudinal cohort of children. It included longitudinal cohort of children who were examined in a sequence of 21 visits starting at birth and ending at 24 months of age. The new growth curves are expected to provide a single international standard that represents the best description of physiological growth for all children from birth to 5 years of age, and to establish the breastfed infant as the normative model for growth and development. So these are the anthropometric measures used by WHO charts. These are weight for age, height for age, weight for height, BMI for age, head circumference for age, arm circumference for age. So these all are the charts that are given on the Google. These are the PDF charts for each, for both boys and girls, and for each age category. So these are the WHO growth charts for birds up to 5 years of age. These are given in z-score. This is for boys. And this is for weight for age. That is, it is denoting weight for age, and it is for girls. And this is representing weight for age for boys. So this is representing BMI for age for girls. So again, it is the procedure that how we determine the parameter on growth chart. Age is at the top and bottom of the chart, and length and width are along the left and right side of the chart. The curved lines show the percentile numbers or patterns of growth. As we have already did, the percentile number means that the child's growth exceeds that percentage of other children of their age. If child is in the 75th percentile for weight, it means that your child weighs more than 75% of children of the same age. It does not matter whether your child measures at a low or high percentile. It only matters that child is following the curved lines, which indicate that child is growing in a healthy way over time. So this is the step. These are the steps. That first we find the child's age at the bottom of the grid, and then we draw a vertical line. As we can see that here the age is given, here it is given from birth up to the 5 years of age, and the length and the weight are given on the left and the right side of the chart. Then we draw a vertical line from the age and horizontal line from the age or height, age or length or weight. And then we draw a dot where the two lines intersect. Then we find the curve that is closest to that dot, and then we follow the line of the curve up. We go all the way to the end. The number at the end of the curve is the child's percentile rank for weight. And so the answer is at the end of that curve. Use and interpretation of the WHO and CDC growth charts for children from birth to 20 years in the US. CDC recommends that WHO growth chart should be used for children up to 2 years of age to monitor growth, while WHO growth standards for children younger than 2 years have been adopted for use in the US. And the CDC growth chart should be used for children teens aged 2 through 19 years to monitor growth in the US. The WHO growth chart uses a growth of breastfed infants as the norm for growth. This is in agreement with national guidelines that recommend breastfeeding as the optimal infant feeding method. The WHO growth chart should be used with all children up to age 2 years of age. The CDC growth charts are a national reference that represent how US children and teens grew primarily during the 1970s, 1980s, and 1990s. It recommends using the references from ages 2 through 19 years and so that healthcare providers can track weight, stature, BMI from childhood to age 19 years. So use the charts listed below when measuring weight and length of children from birth to 2 years of age. Remember that up to 2 years of age, we are calling length instead of height. So the chart which is used is WHO growth chart, and the parameters used are weight for age, length for age, and weight for length. And the CDC growth chart is used for measuring weight and stature in children and teens aged 2 through 19 years of age, and the parameters used are weight for age, stature for age, and BMI for age. Now coming to recent updates. This is the Human Growth Development article titled as Human Growth Development. It highlights that growth charts, CDC growth chart, include children raised in a variety of nutritional conditions in the US. In the CDC chart, the normal range is between 5th and 95th percentiles. The WHO growth chart describes children from birth to 5 years raised under optimal environmental conditions. The normal range is expressed as a z-score between -2 and +2, corresponding to 2 and 98 percentiles. These scores are the number of standard deviations from the mean. The WHO growth charts represent a growth standard, whereas the CDC growth chart represents a growth reference. WHO growth charts are used for children up to 2 years of age and CDC for children beyond 2 years of age. When using the WHO charts, the prevalence of short stature obesity is similar to CDC chart, but the underweight prevalence was lower than CDC charts. Red flags in growth and development. Red flags in motor development and persistent fisting for more than 3 months, persistence of primitive reflexes, rolling before 2 months, and hand dominance before 18 months, no babbling by 12 months, no single word by 16 months, children whose height or weight readings below 5th percentile, above the 95th percentile, or cross two major centile lines need further evaluation. Now, this is the great practice that is monitoring growth and development of child. It highlights that regular growth monitoring sessions should be attended to make sure baby is growing well. Take the baby for growth monitoring and promotion every month during the first year. Attending growth monitoring sessions can help identify nutrition problems. Nutrition problems may need urgent treatment. During growth monitoring promotion sessions, parents can ask questions about their child's growth, health, and nutrition. This is an article titled Establishing Height for Age Z-Score Growth Reference Curve in Stunting Prevalence in Children and Adolescents in Pakistan. As we all know that the height for age curves are widely used for detecting children with stunting, and the aim of this study was to provide smooth height for age growth reference values in the curves for Pakistani children and adolescents 2 to 18 years of age. Prevalence of stunting in Pakistani children was determined, and using the LMS method, height for age growth reference data based on comprehensive sample of Pakistani children aged 2 to 18 years were presented. The analysis showed a significant disparity between our growth references and references of the WHO, USCSC, and of the international population references. A marked difference in the estimation of stunting prevalence among children 2 to 18 years old after applying WHO, USCDC, and local height reference indicate that each country should use its own growth reference charts, since standard charts used from other countries provide misleading information. Population-specific height references can be used to determine and monitor stunting in children and adolescents. More research is also required to overcome the limitations of the present study. Now, coming to MCQs. MCQ number 1. A 7-year-old male child has myelomeningocele. His physical activity is limited, but he is able to use his arms and shoulder. He is unable to stand, so a stature measurement cannot be taken. Which alternative to stature is most appropriate? Crown knee length, arm span, knee height, triceps skin fold, or crown heel length? Any guess? Yes, B is the right answer. MCQ number 2. A growth chart is used by pediatricians and other healthcare providers to follow a child's growth over time. Growth charts have been constructed by observing the growth of large number of healthy children over time. The WHO growth chart differs from CDC growth chart in all of the following aspects except the WHO growth chart used the second and 98th percentile as the outermost percentile cutoff values indicating abnormal growth, while CDC growth reference chart used the 5th and 95th percentile as the outermost percentile cutoff values indicating abnormal growth. WHO is used for children up to 2 years of age, while CDC growth chart is used for children beyond 2 years of age. WHO growth chart standard by which all of the children should be compared, while CDC growth chart the reference that does not imply that pattern of growth is normal. CDC growth chart based on study population of breastfed children, while WHO growth chart also includes the formula fed as well. WHO growth chart tells how healthy children should grow in ideal conditions, while CDC growth chart tells how certain group of children have grown in the past.
A.
No, D is the right option. Because WHO growth chart is based on the study population of mainly and solely breastfed children. MCQ number 3. A 2-year-old boy is brought to preventive pediatric department for evaluation of his growth as he was born preterm and remained hospitalized for some days. Now his parents are concerned and feel that he is not growing normally. When his anthropometric parameters are plotted on graph, he is found to be underweight. All of the following parameters would be used for this child except WHO height for age, WHO weight for age, WHO height for weight, CDC length for age, CDC BMI.
B.
Yes, B is the right option. MCQ number 4. A child of 9 months visits for growth monitoring immunization session. His weight for age is 18th percentile. How is this interpreted? The growth of child is normal, the child is underweight, the child is overweight, the child is malnourished, the child is stunted.
C.
Yes. No, A is the right option because it is falling in the normal range. So, growth of child is normal. A is the right option. MCQ number 5. A 3-month-old child is at the 30th percentile of weight for age. How is this interpreted? The child's weight is up to mark. The child has weight higher than 30% of children. The child has weight higher 70% of children. The child has weight higher 10% of children.
B.
Yes, right option is B. MCQ number 6. Child A and B have same 25th percentile of weight for age. Which of the following is most appropriate? Child A and B both need further evaluation for malnourishment. Child A and B both need no evaluation as this is normal percentile. Child A needs further evaluation while child B does not. Child A needs further evaluation. Child B needs further evaluation.
C.
Yes, C is the right option. MCQ number 7. A mother is concerned about growth of her child. She wants to know what is the first sign of undernourishment on growth chart. Dip in curve, flattening of curve, downward drop in percentile of curve, rapid upward slope in percentile of curve when the child has a growth less than third percentile. First sign of undernourishment.
B.
Yes, B.
Flattening of curve.
Yes, B is the right answer. MCQ number 8. A 3-year-old girl has weight for age and height for age both child. However, weight for height is normal. The eating habits of the child is normal. She has no signs of malabsorption or any other disease. The height of parents is also short. What is the most appropriate diagnosis? Constitutionally small child, acute malnutrition, child is affected by acute famine, child has acute stress, malabsorption. Yes, A is the right option. MCQ number 9. A 9-year-old child came for regular growth monitoring. Visit. The child has regular plotting of BMI over time. A house officer is concerned about the dot shown in red. What might have been the most likely cause? Acute diarrhea, chronic hepatitis, starvation or long time, micronutrient deficiency, chronic malabsorption.
E.
No, A is the right option because in acute condition there can be a sudden drop, but in chronic conditions there is a flattening and then there is downward slope. MCQ number 10. A mother came with her 9-year-old daughter for routine checkup. She has the growth chart of her daughter. What will you advise the mother? The child is growing well in road to health zone. The child is gaining weight rapidly, require immediate further investigation. The child is gaining height rapidly, which requires immediate further investigation. Further evaluation will be required if child crosses 95th percentile. Evaluation is required only when child loses weight. There is
B.
rapid upward slope. Yes, B is the right option. This is the key of MCQs. This is YouTube link of this presentation, and thank you.